Improving success rates in IVF. Now, several patients come with repeated failures and they want to know what more can be done for them. How do you improve success rates? Number one, go through the history and find out what exactly is wrong, and if there is anything which you can find in the investigation, like inside you do a hysterosalpingogram, you find a problem inside the uterus, you correct it. If there is fluid in the tubes, do a laparoscopy and clip the tubes so that the fluid does not enter the uterus. But the most common concern is about the quality of the egg and the quality of the sperm, which you can improve with medical treatment. And for men, lifestyle modification and medication can improve the sperm count and decrease the DNA fragmentation, which is an enemy of fertility. Technology has grown so much that improving success rates is fairly better now. In 1990, the success rates was 8%. Today, our success rate is 80%. So how do we think we have achieved this? Now, when you look at the sperm, normally sperm is selected at 400 magnification, and that is called ICSI. Once a baby is created, you put it in an incubator, which is an open system. Daily you take the baby out, check under the microscope for development and put it back. Now, this technology gives you a success rate of about 55 to 60%. Highest technology means your sperm is selected at 7,000 magnification, and that is called IMSI. And once the baby is created, you put it in an incubator called the embryoscope, which is designed like the human fallopian tube with the oxygen, carbon dioxide, nitrogen, temperature, humidity, everything is like the human body. So the quality of the embryo is much better because it grows under natural conditions, and there is an inbuilt camera which keeps taking pictures of embryos automatically every 20 minutes, and once all the data is ready, it is analyzed and the embryos are graded, and you can select the best embryos to put back into the uterus. Once the embryo is ready to go into the uterus, sometimes the shell is very thick, so the embryo is unable to come out because it takes a long time to come out because of the thick zona. So if it is late, it's already old, success rates drop, miscarriage rates increase. So we use the laser to thin it down so that it comes out on time, and this improves success rates and decreases the miscarriage rates. And to help it further, we coat the embryo with something called embryo glue, which is a sticky substance, helps the embryo to stick into the lining of the uterus and improves implantation and pregnancy rates. Now, if there is a problem with repeated miscarriages or repeated implantation failures, taking a cell from the embryo by using the laser and sending it for genetic analysis is very, very important, and this is called pre-implantation genetic diagnosis. The normal embryos are selected and the abnormal ones are deleted. There is also a problem in some patients where the lining of the uterus has to receive the embryo at the right time, and that is called the window of implantation. So some people have a very broad window, many days. Some have a very narrow window. So you look at the genetic analysis of the endometrium by taking a small bit in a mock cycle and sending it for genetic testing. This gives you the exact time after starting progesterone injections to put back the embryo, and it works surprisingly in about 85-86% of patients where they are very, very difficult patients, repeated implantation failures, and repeated failures means it's so much of disappointment to the patients. And when we use all this technology, the success rates really improve, and there are patients who have failed 8 times, 9 times, 12 times, and they've all succeeded in an attempt. When you improve technology, when you associate or when you include all these technologies and use all of them to improve the pregnancy rates, it really works. And at least when all these are used in at least 90% of patients, you can be very sure that you can achieve a pregnancy.